Bengals quarterback Joe Burrow came up limping on this play earlier today at training camp, appearing to injure his right calf area. And in this video, we'll take a closer look at what happened and how severe this might be. Welcome back, everybody. I'm Dr. Brian Sutterer. My goal in this channel is to help teach you about the medical side of the sports world. So if that kind of thing interests you, please consider subscribing to stay up to date and support the channel. Let's dive right in and take a look at this play here for Burrow from earlier today. So we can see he's kind of scrambling out to his right here. Keep an eye on this right lower leg because that's the side that ultimately was injured. Now, I will say from past, I don't recall seeing Burrow wear a compression sleeve like this on his right lower extremity. So I do wonder if he was dealing with some discomfort, some soreness maybe in the calf, because typically I don't remember seeing him wear something like this, especially in previous training camps. But as he runs out to the side here, where it's probably on this step where he plants with that right foot and then is going to be pushing off, where the injury to the calf or the area in the back of the leg probably occurred, because this next step where he stretches out, he lands a little bit awkward where he plants directly on that right foot and then comes up limping afterwards. And so it was probably this step before. And looking at the whole lower leg, I don't see anything abnormal, number one, with his knee. Okay, I know he's had the ACL injury in the past. Nothing about the knee shifting in one way or the other. We obviously don't have a great camera angle to look and see if there was anything like a pop like you'd worry about with an Achilles rupture. All we see from this position is his foot is in some ankle dorsiflexion, meaning the toes are closer up to his shin is forward over his foot. That's going to, of course, stress the gastroc, stress the calf muscle complex in the back of his leg as he's pushing off and exploding. So the perfect scenario with when we could see a typical calf strain. As Burrow down to the ground here on this whole sequence, it is nice to see. It looks like he is grabbing more in the gastrocnemius kind of muscle region. We don't see him grabbing down at the ankle like we will oftentimes when guys suffer Achilles ruptures. This really seems to be targeted. We see him grabbing the calf right there, in fact. So I have a lower suspicion about something like an Achilles rupture. Unfortunately, he did have to be taken off the field on a golf cart. My concern for Burrow would be most likely a calf muscle strain rather than something catastrophic like an Achilles tendon rupture, but more serious than something like just muscle cramps. Typically muscle cramps, you don't need to be taken off the field on a golf cart. You can walk off the field on it, but a muscle strain would likely be more severe. Looking at our biodigital anatomy tool here, what you need to remember about the calf, the gastrocnemius muscle complex, is it's actually a group of two muscles. The most superficial ones that we see just looking at the skin are going to be the medial and the lateral heads of the gastrocnemius. That's the main calf muscle. Deep to the gastrocnemius is going to be the soleus. The soleus is actually a really powerful muscle. It's really important when we're just standing around at helping to keep us upright. But the soleus muscle sits right here deep below the gastrocnemius. The typical calf strain is going to be a tear or an injury to these gastrocnemius muscles. Specifically, most common is going to be this medial, or the one on the inside portion between the two. Now, what you also need to understand is, of course, the Achilles tendon comes off from those two muscle complexes to eventually go down and insert on the ankle. Like I said, I would be surprised if this was a true Achilles rupture just because Burrow didn't grab down in that area. He seemed to be grabbing the calf. What you need to remember, though, is that that tendon extends all the way up to where these muscle bellies are located. And so injuries can occur at this region called the myotendinous junction, where the muscle joins to the tendon, and can still be really severe and have a prolonged recovery period, aside from what we typically think of with an Achilles rupture, which is going to occur much lower down here. The best case scenario here with Burrow is that this is a mild strain in purely the muscle belly itself. That type of an injury is something that you might only be out for a couple of weeks. But as these injuries get more severe, what you can do is you can actually injure what we call this aponeurosis. The aponeurosis is the area of this whole complex in this anatomy where the muscle and the tendon are really coming together, especially superficial right here to the soleus. So kind of right in this area is going to be that area of the free aponeurosis. And if this area gets torn along with injury to the underlying muscle, that is an injury that can keep somebody out for a couple of months, if not longer. We saw Karl Anthony Towns in the NBA have a really prolonged absence from a calf strain. So even though it sounds very benign, like just a muscle strain, depending on where the strain occurs, meaning if it's just in the muscle belly, or if it's closer to this junction where the muscle is feeding into the tendon, that injury can be more prolonged and could be something that could see Burrow limited at the start of the season. This image highlights that really well with what I'm talking about with the aponeurosis. So the Achilles tendon is going to be coming in down in this direction right here, down towards the foot. This is going to be the gastrocnemius muscle, the soleus muscle deep to it, And then this fibrous connective tissue right through here is going to be that aponeurosis. It's where that gastroc is blending into the soleus, ultimately blending into the Achilles tendon. And injuries to this area, to this aponeurosis, are a much more significant calf strain than just your run-of-the-mill injury sitting up here in the muscle. So with calf strains, like most things in sports medicine, it's all about location, location, location in terms of the ultimate recovery time. As Burrow goes to take this step right here on that right side, his ankle being in a dorsiflexed position and his knee relatively extended right here is going to put excess stress and stretch on that gastroc complex. And then as you push off, you're contracting a muscle that's already in an elongated position. And so this is when muscles are prone to being strained or torn. There's not a long history of quarterbacks having calf strains in terms of great data for quarterbacks specifically, but like I said, depending on what type of muscle strain this might be, if it is in fact a muscle strain, this is something that could range from just a couple of weeks to something that could keep him out for a couple of months and affect his availability at the start of the season. Again, low concern for something serious like an Achilles rupture just based on where he was grabbing, but higher concern than just something benign like muscle cramps. We'll await the final word, potentially an ultrasound, probably an MRI scan to look at exactly where that tear is located, because that affects ultimately how long the recovery will be. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.